And this is a patient. Hello, I'm Dr. Jason Collier at the Southern Dental Implant Center, and this is case study number 3 of our video blog. This is a patient that was referred over to us with one of her front teeth having fractured off. You can't really see it in this x-ray, but this tooth had fractured off, had come out, and it's temporarily put back in place until we could do something more permanent for her. And this, if you can see, this tooth has been treated with a root canal. When a root canal is done on a tooth, you take out the blood supply and the nerve supply to a tooth, so it becomes a dead, dry, brittle tooth. So it's not uncommon for us to take out root canal treated teeth that have fractured. It's something that we actually do on a fairly regular basis. Not that root canal treatment is a bad treatment, but teeth do become much more brittle, and so this is something that happens fairly frequently. So we talked with this patient about her options, and she elected to proceed forward with having the tooth removed and implant placed. Now, sometimes when we place implants, we can put a restoration on the implant right away, immediately, the same day that we place the implant. So sometimes we can, at the same time that we take the tooth out, we can place the implant and a temporary on immediately. Sometimes we have to wait a few weeks, 12 to 16 weeks on average. This patient happened to be one of those where we could place the temporary right away. So this next image is the day of the procedure, where we took the tooth out, placed the implant. This is the x-ray with the implant in place and a temporary on top of the implant. And this is actually 1 week later. Tissue is looking perfect, looks very natural. The tooth looks very natural, like it belongs there. If you look closely, you'll see that this tooth is just a little bit shorter than the other, and that was done intentionally to prevent any kind of undue pressure being put on that implant before the bone had integrated to the implant. It's a process that we call osseointegration. So once the bone has integrated to the implant, then we're ready to proceed with a final prosthesis. And again, that takes 12 to 16 weeks to allow the bone to mature around the implant, or osseointegrate. So this next image is after the final restoration had been put into place. And again, sometimes we have doctors who refer patients to us. If it's something that's complex, oftentimes we are asked to just go ahead and see the patient from start to finish. And there's sometimes where our doctors will, if they feel comfortable treating the patient with their final prosthesis, then we'll refer patients back over to them, or we can work together on a treatment. And this is one where we referred the patient back over to the referring doctor, and the doctor put the final prosthesis in place. Looks beautiful, looks like it belongs there. And this is a photograph taken even a year later. So the tissue's still looking beautiful, looking very natural. Restoration is looking good. And so we have another happy patient. So if you feel an implant would be something that could enhance your smile or boost your self-confidence, or if you're a doctor and you have a patient that you feel like could utilize our services, please give us a call. Again, I'm Dr. Jason Collier at the Southern Dental Implant Center, and this has been case study number 3. Why is everybody looking at me?